Can you tell the audience a little bit about the exact project that you've been that you presented and you've been carrying all through those years?
Of course. So we talk about a couple of examples of how we have been taking evidence-based programs and putting that into action for the benefit of the community. I started by providing one example with the diabetes prevention program that is now being rolled out nationally through the CDC, and that has been incredibly at reaching out to people in the United States, but also where the gaps are in talking to or holding on to participants who might not have the right resources to attend to these programs and to stick to these programs. So then, to see how do we overcome these barriers, I provided the example of the Mediterranean diet, which has been promoted. There's very strong evidence around it. It is promoted by the Dietary Guidelines for America. And one thing that we have noticed, though, is that when we're doing our work with our communities, they might not eat or might not be familiar with the foods that are in this pattern. So we talked about how we've been adapting this in Puerto Rico, which is a community that has social and health inequities. And we went through the process of learning more about the foods that would still fit with the Mediterranean diets and would still be healthy. We did cultural adaptations around those foods, but also around the messages that spoke to the food that they wanted and the culinary techniques that would be important for them and the values that they put on the foods and the family and this culture. And then, what metrics we can use to then assess the effectiveness of these programs. And then eventually, can we take that to policy?